How can your neck cause headaches? Well, there's this thing called referred pain. The easiest description of referred pain that I can come up with, I say this to my patients all the time, is a heart attack. If you're having a heart attack, you get this referred pain down the left arm. Some people will feel it up into the jaw or the side of the face. There's nothing wrong with your left arm. It's your brain saying something is wrong over here, but not being able to perceive where it's coming from. Your brain is not very good at picking up where pain comes from. Your head and your neck are developed from the same zones during embryonic development. And so neck pain can often feel like head pain. And so the muscle tissues and the joints in your neck, if they're really inflamed and really flared up, patients will feel pain in their head. They'll feel like they have a headache in the temples, or they'll feel like they have a headache right on the top of their head, or they'll feel like they have a headache right behind their eye. That isn't necessarily brain related. That is most likely neck related headaches. And if you can go to a good therapist that can find those areas, push on them, and recreate your headaches, well, you've pretty much nailed your diagnosis. That's the thing that I'm looking for when I'm assessing a neck is, can I reproduce the headaches that the patient is experiencing?